Hi, I'm Lauren. I'm outside of the Queen Elizabeth II Health and Sciences Center. It's a hospital and infirmary right here in Halifax. It probably had something to do with treating the 54 deaths from opioid overdose in Nova Scotia alone in the year 2018, which is only last year. So it's a little bit loud and I think it's going to rain, so let's take this somewhere else. Ooh, okay, that's better. Much quieter, plus now we won't disturb any possible patients or visitors to the hospital. But let's talk about those possible patients for just a second. So, people who abuse substances might be treated at these hospitals for more than just overdoses that threaten their lives. But some large barriers arise in their ability to receive effective treatment. A large barrier is stigma. Stigma against themselves, stigma against drugs, stigma based on communities and how they view substance abuse disorders. Did you know that stigmatizing aspects from treatment plans, treatment professionals, and self-stigma interfere with a patient's ability to connect with their treatment program and with their own selves? An article about the association between perceived stigma and substance use disorder outcomes overviews some of the many ways that stigma against those who use substances can hinder those seeking treatment, but also how treatment with uncompassionate practices can push away people from seeking treatment in the first place. It's important for healthcare professionals of all kinds to understand how to make treatment more effective because substance abuse disorders are primarily a health issue. It's registered in the DSM as a mental disorder. And in 2012, about 21.6 Canadians, 6 million people, met the criteria for a substance use disorder. That's a lot of people that we aren't helping effectively. That's a lot of people who can face jail time for a health issue. And when's the last time you heard an ex-inmate say prison was great for their health? The truth is that we need to stop treating those with substance abuse disorders like they're bad, that they're criminals. We need to start treating 6 million Canadians with the same compassion we treat those with any other disorder. If 6 million people is too big of an idea to wrap your head around, then I'm sure we can all think of 54 people in our lives we'd be devastated to see pass away from a health issue that we as a nation are failing to treat.